studying really difficult. So psychiatric disorders that affect the student's ability to concentrate definitely impair their ability to study and focus and rehearse their information.
Okay. What's your advice for any parent who have a child with a psychiatric illness? Do you recommend that to do certain procedures or check about their medication, if they are taking their regular medication, or increase their medication if they need, if they found that the exams is bothering them?
Okay. Well, first of all, let me go one step back.
Okay.
I just would like to give an example of a colleague of mine who consulted me regarding her daughter. I don't remember the age exactly, but about 9 or 10, and in that age group. And she said, my daughter used to be an A student, and now her grades are deteriorating. She used to be in the 80s, 90s, now she's in the 70s. So there is a change in her academic achievements.
Okay.
And she said, do you mind to have a look at her? And I said, okay. So I met with the daughter and I sat with her and I said, I'm sorry to tell you, but your daughter has depression. And she said, okay, so what to do? I said, well, she needs to be on medical treatment. She said, fine. Of course, she's in the medical field. She's a colleague, so she understands, that. And we started the treatment for her, and I saw her after a month. And recently I also asked the mother, how's your daughter doing? She said her grades are going up again.
Okay.
And she feels much better. She is no longer feeling, agitated or irritable or not focusing on her studies. Because if we talk specifically about depression, it really, changes many things in the child psychology and behavior. They have low self-esteem. They don't have self-confidence. They see themselves dropping and they don't understand why.
Okay.
They don't understand. Also, adults do the same too. And many adults go through depression and they don't know what is going on. Their level of functioning is deteriorating and it is because of the depression.
So I know when we are talking our tonight is about stress and exams, but you just mentioned something that during their anybody during his career that if he found that he's not functioning probably in an appropriate way, and he start to find that his achievement is decreasing or he's not like before, this could be a sign of depression.
Yeah, quite a common sign, and not everybody in that with these symptoms should come. But however, if it is leading to a significant degree of impairment, then in that case, I think they should consult a psychiatrist.
Okay. Yeah. Now, we talked about depression. Now, what about anxious patients who are in normal situations, they are anxious?
Anxious, yes.
During exams, the level of anxiety will be very high.
Yes.
How to cope?
Well, it depends if it is just an exaggerated level of anxiety or pathological level of anxiety.
How do you differentiate between the two?
Pathological level, like you said, there are some students who will, not do the exams, like we were talking before the program.
Yeah, before we were chatting about that.
Okay, before we start, you mentioned that there are some doctors reach to the exam level and they don't go for the exams.
Yes.
This is pathological. This is exam phobia.
Okay.
Okay, and definitely needs, attention and treatment.
Okay.
Okay, whether temporary or long-term treatment, there are some medical help for these people. Now, people who have exaggerated level of anxiety can be, I'm kind of going to your other questions, like when you said, do you recommend to talk to, these students? If they need help, can they talk to someone?
Can they talk to somebody?
Yes.
And if they would like to talk to somebody, who's the right person to
Now, usually the immediate person available is your parents, and they should be the ones who guide their children as to, the proper way of studying for the exams. Okay. And logically, if the parents went through these period of studying and exams, they will be better able to advise their children than parents who are not illiterate
okay.
or have no experience about exams. But let me just take one step aside and take about the whole, global thing about studying and exams, because I may sound that I'm diverting from the topic, but it is actually related to what we are talking about, because it's the philosophy of studying. Whenever I see students, because I'm also on top of being a general psychiatrist, I'm also a child psychiatrist. I see children who are having difficulties in their studies, and some of them are just not motivated and not keen, and they don't want to. And I tell them, listen, my job is a doctor. Your job is a student. This is your job, and the passport written as a student. Okay,
and you have
this is your job. Okay, this is your job. Okay. This is what you are doing as a job for. Okay, you don't earn money, but this is your title right now. So, in that case, preparing for the exams, it's not about just knowledge and how to get the grade. It's about the structure, which will help them. This is what, we did not understand when we were young children, but now being a psychiatrist, taking the bigger picture,
all the wisdom that we have,
it's a structure. It is how to put a structure for yourself. Okay. This is where the advice comes from the parents. How to put a structure, how to organize your schedule for the day, how to set a time and to take rest, like you mentioned earlier.
All these are skills that you have to adapt and learn with time and use it for your
life,
normal life after you finish studying.
That's what I am using the analogy.
But nobody is using all these skills. Nobody is organizing their time. It's tend to be more like chaos.
Well, this is the advice that either a well-informed, educated parent can give to their children. Or if the parents are struggling with that, they can go to a child psychologist, and rare cases child psychiatrist, but to get some guidance as to how to guide their children in studying. It is the philosophy. It's teaching the students how to take charge of their own job being a student, and how to cope with all kinds of stress.
Okay.
I always say when we are now in the adult life now and in the working life, when we are coming to a project, you say to someone, did you do your homework on this project? We use the word homework.
Homework, still.
Homework.
Yeah, because what means a task? It's your task, your job to do it in different time, maybe during the working time, during studying time, and sometimes you may need to use extra time for, during your free time to do this job, because it's a part of task.
Yeah, sorry to interrupt. But if we can give this message to our children, to our students, this will make, it's more meaningful to them how to sit and organize it. It becomes not like just passing and studying and revising this topic, but it becomes more meaningful.
Okay.
Yeah.
Now, as everybody knows that, the best thing to overcome stress exams is to prepare well from the beginning of the year, and to be ready in any time for exam, not to wait till the last moment to do that. But it's very common that people depend on the last minute preparation.
Yeah.
And even for people who are A students, sometimes they prefer to study extra in order to guarantee the A and guarantee to have a high score. But sometimes this may be may give you the different consequences. That you may fail, or you may get lower grades if you study very hard. Do you experience this in normal people, like in the people with the mental or psychiatric disorders, that if they study too much, instead of having high grades, they will do bad? You mentioned about exhaustion, but
yes.
Rereading several times, can this affect their self-esteem or their confidence in themselves?
No, the bottom line in the students who have psychiatric disorders is that they should really have whatever disorder they are suffering from controlled.
Okay.
With medication, with therapy, you know, whatever that they are, treatment they are using, treatment methods they are using. So it's, there are many students who have anxiety or have depression or have other disorders, and they are being treated, and they go through their exams and they get the A's. It's not an impossible thing to have. So they will be, when their condition is controlled medically, then what applies to them applies to the rest of the students.
Okay.
There are no exception.
What about students who they read something, they memorize it, then they'll go back and read it again, and they all the time they have this kind of fear or the idea that they will not remember during the exam.
Yeah.
Does this have meaning?
This is very common. We all went through it.
I know we have that.
We all went through it. It's like you think that you don't know, but the minute you enter the exam hall and you hold your pen or pencil, and you'll see the information is flowing. It's just this kind of idea that you get a block or there is a vacuum in my head, but there isn't actually. Thank you, because your question is pointing to me, it's not a matter of just getting the information, it's a matter of how you organize your information, how you plan, how to study for any topic. Okay? And my secret as being one of maybe getting honors students or that, I always study all the exam questions.
Okay.
Whether this was in high school in Kuwait or it was in medical school in Ireland or with my training in Canada.
Trying to solve the unknown?
No, but
it's trying to know the answers in order to have idea about the unknown?
It is using one of what they call the Socratic method, is that when I tell you Cairo is the capital of Egypt, okay? I'm just giving you information. The information, if I give it to you in another way, and I say, what is the capital of Egypt? And you go, I don't know. And I say Cairo. When I make it in the form of question, the information stays in a more steady way in your system.
Okay.
That's information. That's how our brain processes information.
Okay.
So this is what the exam questions do to you. They challenge you, and they make you say, what is the answer to the question?
Okay.
Rather than go reading about the heart or reading about geography and what's this, it's boring.
Okay.
But when you go and read the exam questions, it becomes stimulating to you, and in that way it is reported that the information tends to stick to your head better.
So the one tip from you for the students is to rephrase or try to make a question.
All the exam questions and answer them.
What about reading a topic and try to find a question and read the topic and try to find the good questions about this topic in order to remember the information inside that topic?
It can work. It can work.
But read the good questions.
But if you get the official exam questions and you go through them, you cover a big part of the syllabus.
Okay.
And that's what you want.
Okay. Now, one of the tricks that some people use and they think it's helpful is using music, and some people, studying in different areas. Can you practice that, especially when the music is loud? For me, I can't understand how people can understand and comprehend in loud music, but some students, they will challenge their parents when they are listening to loud music, that it helps me to concentrate.
Yes.
Can be this true, or?
Okay, it's again, like you asked me earlier about whether studying alone or in group.
Study group.
It is whatever works, provided that you are not causing too much noise.
Noise to the others,
to your family or to your neighbors, okay? Now, again, I kind of say something about myself. When I used to do my homework in high school, I used to have music in the background. But during studying for exams, I just need, nothing to distract me. I need silence. But if the student, if a given student